I'm Lauren Maloney. Thanks for joining us today on What Matters This Week. Health Commissioner Dr. Mark Levine for the state of Vermont is here. Doctor, appreciate you being with us.
Glad to be here.
We did have some news this week when it has come to vaping. The first vaping-associated severe respiratory illness identified in Vermont. And this is just, what, 2-3 weeks after you put a big call out from health providers saying you wanted to hear of any cases or symptoms.
Exactly.
Are you surprised we got here so quickly with the first case in Vermont?
Not terribly excited, because the fact is, there's about 400 cases nationwide that have been confirmed. And if you think about the size of Vermont, it's in proportion. There are several other cases we're actively investigating still, but they haven't risen to the level of being probable or confirmed at this point in time.
Is there any part of the person's condition, and I know a lot of this, that you have to keep close to the vest, that you can say about whether the person is critical, serious?
Can't really give any details of the case, but I can tell you that across the country, this fits the kinds of cases that have been seen. There are all age groups have been seen, though people are very much focused, as they should be, on the fact that there are teenagers and young adults who were previously healthy. But all age groups have been seen, people with all kinds of health histories, if you will, some very healthy, some not, males, females.
Okay.
All this is really important information for us to gather. And that's why we're really happy to participate with other states with the Centers for Disease Control,
Sure.
Because this is really unfolding before our eyes, and what we call an epidemiologic investigation, where we're trying to characterize every case and understand where the commonalities are, and hopefully get at what the causes are. Because until today, still, we don't know the exact cause of this epidemic. We just know that to satisfy a case definition, you have to have been using electronic nicotine delivery systems or vaping products within the past 90 days. You have to have characteristic symptoms, which are shortness of breath, cough, sometimes chest discomfort when you take a deep breath. Some individuals have had some gastrointestinal symptoms leading up to it, nausea, vomiting, diarrhea. Fatigue is common. So that constellation of symptoms and a fairly exhaustive workup that has not shown any infectious cause, nor any of the other obvious known respiratory diseases that could cause the kind of presentation and X-ray findings that are being seen in these cases.
I imagine the earlier the better when it comes to getting treatment and the treatment protocol for these individuals.
I would love to tell you the answer to that is yes, but there is no treatment protocol. Because we don't know the cause, so it's supportive treatment.
I see.
The typical antibiotics you would use in many types of pneumonias are not going to be effective. The CDC has said that some populations have received steroid therapy, corticosteroids that are commonly used for inflammatory diseases of the lung, and some individuals seem to have responded to that, but they can't give a general rule that that's been the theme. So that would be something that a clinician might try as part of the treatment for someone where they couldn't find any other cause and were really trying to do anything they could to help.
You have said that to date there's no specific e-cigarette or vaping product or substance that has been linked to all of these cases.
And that remains true, and that's why part of the investigation involves very meticulous reporting, not only of what's going on with the person, but what did the person actually use? Was it a commercial device? Was it something they obtained on the streets or in the black market? What was in the pod of liquid? Was it a oily liquid? Was it a colored liquid? Did it have only nicotine in it? Did it have THC, the active ingredient in marijuana? All of these things have to be discerned. To really understand if there's a single smoking gun, if you will, that we would say, oh, everybody had this in common.
Right.
Currently, that doesn't seem to be the case.
Now, at the end of the week, it was announced a Missouri man died from vaping-related complications, an 8th death.
Across the country, more than 500 people are sick. We'll be right back.